Hello and welcome. Today we're delving into a rare and complex inner ear malformation known as Mondini Dysplasia. This condition can significantly impact hearing and balance, and understanding it is crucial for those affected and their families. The exact cause of Mondini Dysplasia is often unknown, but it's primarily considered a congenital condition, meaning it's present at birth. In many cases, it arises sporadically during fetal development. Genetic factors are believed to play a significant role, and some instances are associated with specific genetic syndromes, such as trisomy 13 or branchia-oto-renal syndrome. Environmental factors during pregnancy, like certain infections or exposure to toxins, may also potentially contribute, but this is less well established. Mondini dysplasia affects the development of the bony labyrinth of the inner ear. Normally, the cochlea responsible for hearing forms a complete spiral of 2.5 turns. In Mondini dysplasia, this spiral is incomplete. Typically, only 1.5 turns are present, resulting in a shortened and abnormally shaped cochlea. Furthermore, the bony partition separating the cochlea into different chambers, called the interscalar septum, may be absent or incomplete. This disruption can affect the way sound vibrations are processed and transmitted to the brain. The vestibule and semicircular canals, responsible for balance, can also be malformed, further contributing to associated symptoms. Due to its rarity, precise epidemiological data on Mondini dysplasia is limited. It's estimated to occur in less than 1% of the population. However, this figure may be an underestimation, as mild cases can go undiagnosed. Mondini dysplasia accounts for a percentage of congenital hearing loss cases. It is also important to note that the condition may be associated with other congenital anomalies, increasing the likelihood of diagnosis when other conditions are present. The signs and symptoms of Mondini dysplasia can vary considerably depending on the severity of the malformation. The most common symptom is hearing loss, which can range from mild to profound and may affect one or both ears. The hearing loss may be progressive, meaning it worsens over time. In addition to hearing difficulties, individuals with Mondini dysplasia may experience balance problems, such as dizziness or vertigo. Some may also have delayed motor skills development. In rare cases, cerebrospinal fluid leaks, or CSF leaks, can occur due to abnormalities in the inner ear structure. Diagnosis of Mondini dysplasia typically involves a combination of audiological and radiological assessments. An audiogram, or hearing test, is essential to determine the type and extent of hearing loss. High-resolution computed tomography, or CT scan, and magnetic resonance imaging, or MRI, of the temporal bones are crucial for visualizing the inner ear structures and identifying the characteristic malformations associated with Mondini dysplasia. These imaging techniques allow doctors to assess the cochlear structure, vestibular system, and semicircular canals. While Mondini dysplasia is primarily defined by the characteristic cochlear malformation, variations can occur in the extent and specific structures affected. Some classifications categorize the condition based on the severity and specific anatomical features observed on imaging. For example, some classifications consider the presence or absence of the interscalar septum and the degree of malformation in the vestibule and semicircular canals. However, these classifications are not universally standardized, and management is typically tailored to the individual's specific presentation. There is no cure for Mondini dysplasia, so treatment focuses on managing the symptoms and maximizing hearing and balance function. Hearing aids are often beneficial for individuals with mild to moderate hearing loss. Cochlear implantation can be a highly effective option for those with severe to profound hearing loss. Vestibular rehabilitation therapy can help improve balance and reduce dizziness. In rare cases where cerebrospinal fluid leaks are present, surgical intervention may be necessary to repair the leak and prevent further complications. Regular monitoring of hearing and balance is essential to track any changes and adjust management strategies accordingly. As a congenital condition primarily influenced by genetic factors, there is currently no known way to prevent Mondini dysplasia. Genetic counseling may be beneficial for families with a history of congenital hearing loss or genetic syndromes associated with Mondini dysplasia. This allows families to understand the risks of recurrence and explore options like prenatal testing, if appropriate. Promoting overall maternal health during pregnancy, including avoiding exposure to toxins and infections, is always a good practice, although its direct impact on preventing Mondini dysplasia is not definitively established. The prognosis for individuals with Mondini dysplasia varies widely depending on the severity of the condition and the effectiveness of interventions. With appropriate management, many individuals can achieve good hearing and balance function. Cochlear implantation, in particular, has significantly improved outcomes for those with severe to profound hearing loss. Research continues to explore the genetic basis of Mondini dysplasia and to develop new strategies for improving hearing and balance outcomes. This research includes investigations into gene therapy and regenerative medicine approaches, which hold promise for future treatments. Recent advances also focus on improving the precision and effectiveness of cochlear implantation techniques, aiming to maximize hearing restoration and minimize complications.